around the world.
I'd like to quote one of your officials in court documents that were reported on by Rupa Subramanya, and one of those officials is on the call today, actually, and let me quote in an email. To the extent that updated data exists or that there is clearer evidence of the safety benefit of vaccination on the users or other stakeholders of the transportation system, it would be helpful to assist Transport Canada supporting its measures. That's a quote from ADM McCrory. Now, the mandates were set to be implemented, but your department didn't even have the information that indicated it was necessary or based in science. To just circle back to your question about the science that's being followed by municipalities and provinces, they have all eliminated their mandates since, yet you have not. So if you're following the same science they are, why have they all lifted their mandates, but you have not?
Mr. Chair, first of all, let me start off by saying vaccines have proven to have saved lives and continue to save lives. At a moment in time where our public health system is under a lot of pressure, vaccines continue to be an incredible tool in saving lives and protecting the health and safety of Canadians and our healthcare system. The federal government has suspended most of our mandates. The only mandate that we have is at our borders, like many countries around the world. And it is done to ensure that we minimize the importation of the virus and that protect the health and safety of Canadians. And let me point my honorable colleague, on top of all studies that have been done over the last 2 years, just the last 2 months, 2 different studies. One was done by the Canadian Medical Association. One was done by UBC, the University of British Columbia, that demonstrated that these public health measures, including mandates, protect the health and safety, have saved upwards of 60,000 lives, have prevented the importation of the virus tenfold at our borders. So there's ample evidence that I'm happy to table with committee that provides justification for these vaccines.
Well, thanks very much. We look forward to you tabling that information. Over 60 countries around the world have abandoned all of their air travel pandemic restrictions, including most of our European allies. And, PHAC internal reports suggest that air travel had almost no impact on COVID community spread, less than 1%. So it is questionable why those would still be in place. The Minister, you're talking about, again, about science. The CDC in the United States, with whom we share a border, says that it makes the most sense not to differentiate between the vaccinated and the unvaccinated, and that sub-jurisdictions don't need to start making mandates. So, Minister, let's talk about the mandates that you still have in place. What are the current regulations for air and train travel in Canada with respect to COVID-19?
Mr. Chair, there are still many countries around the world that require a proof of vaccination for international travel.
Your mandates, Minister. I've got less than a minute.
Second, currently, the Canadian government has suspended our vaccine mandate for our transportation sector, so there is no requirement for domestic or international travel for people who are leaving the country, whether they want to get on a plane or a train.
So, Minister, do you have to wear a mask on a train or a plane? And if someone does not, what should be the consequence for that person?
Currently, we maintain a mask-wearing policy for federally regulated air or train sector. It is scientifically proven that masks reduce transmission upwards of 80%. We're doing everything we can to protect the health and safety of Canadians, and it is the prudent thing. In fact, it's the kind thing to do to protect
10 seconds,
those
please, Minister.
sitting next to you.
Minister, your Prime Minister was seen not wearing a mask on a train just mere weeks ago. Was that not prudent or kind of the Prime Minister?
You can follow up on that question at the next round, Mr. Barrett, or